Okay, thank you very much. I'm really pleased to be co-presenting with Mari this morning because she and her organisation have been hugely involved in this work. I'm going to talk about a journey in Fife to develop trauma-informed approaches focusing on violence against women. This work has involved a lot of partners and various strands, and I'm going to look at probably about the last 5 years and the work that our partnership and specialist agencies have been involved in. To be fair, our main focus has been in relation to domestic abuse and sexual violence, and that really reflects upon the specialist agencies that we have in Fife. And probably some of us at the time were talking about responding to the challenges of service users with poor mental health rather than trauma-informed approaches in the first instance. Our third sector agencies, which are Fife Rape and Sexual Assault Centre, our Adult Survivor Projects and Women's Aid, they were really seeking to have their role and their expertise understood by wider partners. They were looking for more support and better partnership working, particularly from NHS Fife, I think. There were tensions around, there were waiting lists, there were issues about capacity and what the most appropriate services were. And it was very difficult at that time, but it did result, I think, in some very positive collaborative work. Could I get the next slide, please? Basically, what I was wanting to show here was I was asked to pull together a paper to show NHS what the problems were at that time. And it's got information from a number of different organisations, and you can see what the specialist services were getting were significant numbers of referrals from NHS, and that they were supporting significant numbers of women with high levels of emotional distress and mental health issues. And there were other agencies like the police and criminal justice social work who were also talking about the difficulty that they were having at that time and the high levels of trauma that their service users were exhibiting. Can I have the next slide? And basically, when we looked at this as a partnership, we thought that there were three key areas that we needed to work on. One was the fact that there was a lack of shared understanding and language across partners and service users when we're discussing mental health issues. So I think some of our partners were probably much more lax in their definitions than our health colleagues would have been, and that was a bit of a tension. There was also things around how people access services and the referral routes, and whether or not the system worked for them and whether or not they were able to access the help and support that they were needing at that time. And we also were experiencing difficulties around supporting individuals with complex trauma. And the fact that there wasn't really a recognised diagnosis of complex trauma 5 years ago, and clinicians, although they were aware of the issues, they were finding it didn't have legitimacy within the statutory services at that time. So anyway, this was the start of what I think was some very useful discussions that we had at the Violence Against Women Partnership. And I think absolutely critically, it ran alongside initiatives and work that was happening with the Trauma Network in Fife, which was led by NHS Fife. And I think it was very much the kind of working in tandem and together that we were able to move some of this forward over the subsequent years. And so by 2017, our action plan as a Violence Against Women Partnership, we were prioritising mental health, trauma services and recovery services. And I'm going to pass over to Mari and she'll talk through some of the changes that there's been in the last few years.
Thanks, Sheila. So one of the first things was looking at how we would upskill practitioners across Fife. And it was recognised that the specialist NHS services and the third sector specialist agencies couldn't accommodate everyone who was traumatised and needed support. So how were we going to spread out the trauma-informed approach? One of the first things was developing the Solihull approach for adults. And it was developed by the Clinical Psychology Department in Fife, and there was 30 trainers trained, and they then rolled that out across Fife to another 150 multi-agency staff. The Fife Violence Against Women Partnership has been running a training programme for many years, but more recently basic trauma awareness has been included in all the training. So we talk about the window of tolerance, how survivors might present, and the impact of more complex trauma. last year, 2019 to 2020, over 500 multi-agency staff were trained in Fife. The Women's Health Improvement Research had looked at the response from housing officers, and it was recognised that that wasn't good enough. So mandatory training was included, and there was a discussion around trauma in that. And some of the specialist agencies like FRASAC and CASP, Kingdom Abuse Survivors Project, we offer multi-agency training in more specialist subjects, working with men and boys, complex trauma, ritual abuse, some of these more specialist things. The Fife Trauma Network has organised 2 conferences over the last few years, the first one with 100 people and then the next one with 200 people, and we had delegates from all over Scotland come to that, and it was focused on all aspects of trauma and thinking about what we could do better. The Trauma Network has also been promoting an understanding of ACEs with Education and Children's Services, highlighting the importance of maximising children's resilience and the role that staff can play in supporting this. And the NEST Transforming Psychological Trauma Framework was launched, and a short life trauma training group was created in Fife, and Fife created a level 1 e-learning resource for the trauma-informed practice, which has had almost 3,000 hits in Fife, and the level 2 so far is at about 1,700 hits. And there's an expectation that all Fife Council employees will complete either level 1 or 2. And also Link Living, one of the housing support providers, set up a skills academy in 2019 to offer trauma training to homelessness staff in Fife, providing training that's aligned with level 1, 2 and 3 of the national framework. Can I have the next slide, please? So the next bit we're looking at was services and service provision, and for myself working at FRASAC, one of the things was about needing to work in better partnership with some of the agencies. So we've recently, or over the last few years actually, developed a really good connection and working partnership with the psychology department across Fife, and strengthening the relationships and liaising about service users and patients when necessary, and doing joint work on occasions. The CAMS service has helped support and develop a CEDAR group work recovery for children and young people and their mothers from their shared experience of domestic abuse. There's a complex trauma personality disorder pathway being developed within NHS, which takes phased approach to linking to the FME pathway in the Better Than Well project, and there's a focus on safety and stabilisation in community services, trying to move away from a medical model of treatment, but using one that's phased and consistent. 70% of the cases on the psychology waiting list in Fife have complex trauma, and they're developing new initiatives like group-based interventions, emotional resourcing groups, and decider training skills. The Better Than Well project is a new project that's now spread out across Fife, and it's working with adults affected by trauma in childhood, helping them to recognise, understand and manage the symptoms of trauma and to identify personal outcomes to improve health and well-being. There's a new Fife suite, the Forensic Examination Suite, which was developed by a multi-agency team, and Fife Women's Aid have their own specialist counselling services for women and children, providing trauma-informed support and counselling in Fife. Next slide, please. So the outcomes of this have been, very much an increased level of staff awareness and understanding. The training has made a significant difference to staff awareness and understanding in Fife. And I think in FRASAC, we've recognised that as a lessening of the panic referrals that we used to get, where someone had had a disclosure and automatically just said to the person, right, you need to go to one of the specialist agencies. I think those agencies who are undertaking all this training are now managing these disclosures and supporting their service users much more appropriately. If and when there's a recognition that specialist support is required, then they're referred on to the more specialist services. And, I think it goes without saying that we have seen a massive increase over the last few years, and actually in the last few months at FRASAC, a significant increase in referrals. But the workers in the wider community are understanding the impact of trauma. And we see clients at FRASAC now who've already heard of the window of tolerance. They know about PTSD, and that's coming from service staff and other agencies. And certainly in Fife, there's now a greater knowledge that the third sector agencies are actually the specialist providers and that our staff are skilled and professional. Better Than Well is one of the best initiatives that's been created in Fife in a long time, and FRASAC is able to refer our clients when we have a long waiting list. We refer them to Better Than Well, and they have some initial support, and that makes a huge difference. They have some psychoeducation and resourcing that helps them cope until we can provide the longer term support. Okay, I'm going to pass you back to Sheila now.
Next slide, please. What I've tried to describe is a journey that's very much involved both the Violence Against Women Partnership and trauma networks. And I think the strength of it's been that professionals have been able to work together to improve the health and well-being of those impacted by trauma, violence and abuse. And it's been that working in partnership and respecting the strengths of both statutory and third sectors, which I think's moved us on from what started off as a very prickly place to be. I wanted to put up this slide. I think the challenge is really significant, and I think the Hard Edges report, which looked at severe and multiple disadvantage in Scotland, is quite relevant to this. The updated version of it added in domestic abuse and mental health problems, which were there in addition to the original 3 Ds, which were homelessness, offending and substance dependency. And I think that it highlights that poverty, violence and trauma, and it says there's a gaping hole in mental health, and it says that violence against women's services struggle to cater for those with severe and multiple disadvantage. It argues that crisis-focused systems can't cope with the effect of trauma. Local and national systems don't address complex and interacting needs, especially when there's challenging behaviours as a result of coping with long-term trauma. So I think that while we're continuing to collaboratively develop trauma-informed services in Fife, there's a need for this to be higher up the national agenda too. And that's why I'm really pleased that we've got this event today. I think COVID, as has been highlighted, has absolutely exacerbated violence against women in terms of increased abuse and coercive control, and it's made it more difficult for those impacted by trauma to cope. Hopefully, a more trauma-informed approach will help to make sure our service users get what they need from us. And I just want to finish very quickly with this last slide. This was a woman who'd been accessing, sorry, can you get the last slide? This was a woman who'd been in Women's Aid Refuge. She had a mental health diagnosis and was involved in addiction services. And basically what she said, I'll just read it, is everybody's given up on me. My dad gave up on me. But what made the difference was that I knew you really cared. There was no judgment. That showed that you really cared, that you were both honest with me and stuck up for me. So that was someone who was in Women's Aid Refuge at the time. And thank you for listening.